Hey, I'm Dr. Ken Cleveland with Remedy True Health Online Education. I want to talk to you today about low T, or some low testosterone is what you'll hear a lot of also. There's been a lot of advertising on the TVs about low T, and mostly this is to sell the gels that you can rub on and replace low T. Low T is very common in men over 40 years of age. So about 4 out of 10 men over 40 years of age will have low T. So some of the symptoms might be like moodiness, you become the grumpy old man, weight gain, especially around the abdominal area, low libido or low sex drive, lack of focus at work, depression, low energy. Things like this are the things that we see people come in with, and that's the kind of complaints they have when they have low T. Now, the way to know whether you have low T or not is very simple. We just draw a little bit of blood right there in the clinic. We send it off. If the labs come back and it shows you've got low T and then you've got 3 or 4 of those symptoms, then we know that you will probably benefit from treatment. The gels are what you see advertised on TV all the time, and it's probably the most common way used, and it's very easy for doctors out there just to write the prescription and tell their patients, here, you go take this and you rub it on you every day and you're going to feel better. At first, the gels are very well absorbed and your testosterone level goes up and you feel better, and a lot of those symptoms are resolved. But with time, it's not as well absorbed. Your testosterone levels start going back down and you don't have that feeling of resolution of the symptoms that you had before. There are other risks with the gels, like it could rub off on some of your kids, it could rub off on your wife, and we don't want that. I mean, the medicine is intended for you. It's not intended for them, but it could rub on them and then they could have a change in their testosterone levels, which is not what we want. There are methods that I think are better for replacing testosterone. And one of those is injections. I'll write you a prescription, you get your little vial of testosterone, and you give yourself injections either once a week or once every 2 weeks, depending on which regimen we work out for you and what works best for you. Now, you get pretty good testosterone levels by doing the injections, and it will make you feel better. It will resolve your symptoms. The problem is, one, you got to give yourself that injection every 1 to 2 weeks. You got to remember to do it, and so you don't always remember. You may forget, and then you don't feel the symptom resolution that you were looking for. The third way to replace testosterone is with pellets, and I think it's the best way. What we do is we numb up a little area on the side of your hip, we clean it up real good, use sterile drapes, make a small incision, and then I got a special instrument that I can just insert the pellets down into the fat tissue on the side of your hip. And after that, you're good for 4 months. You don't have to remember the injections, you don't have to remember the gels, you don't have to remember anything else. You come back in 4 months, we place some pellets on the other hip, and you're good for another 4 months. I think it's the best way. You get the most stable levels of testosterone out of that. It lasts you the longest. So if you think you have low testosterone, just give us a call at the clinic. Make your appointment, come by and see us. We'll discuss the symptoms real quick, we'll discuss the therapies real quick, and we'll get you started. Give us a call today.